So I'm going to be doing the Foley catheter. The first thing I'm going to do is I'm going to go ahead and check the MR. I'm going to identify as a patient's first and last name and date of birth. I have Anna Pawlowski. Anna Pawlowski's date of birth is 6/12/XX. And she has an allergy to penicillin. I look at the orders and I see that the orders from the doctor for her to get a urinary catheter for urinary retention. Okay, so I gather all of my supplies. I have an extra set of gloves, something to do perineal care. I have my trash here, and I have tape, and I have my urinary catheter kit here. And I'm going to knock on the door and go into the room. Hi, my name is Lovelika. How are you today? Awesome. Can you please tell me your first and last name and date of birth? I'm going to be your student nurse for today, sorry. Okay, Anna Pawlowski. Okay, Anna Pawlowski, date of birth 6/12/XX. And do you have any allergies? Okay, so what's your reaction to penicillin? Okay, so I compared everything to the MAR and to the MAR and to her wristband. Okay, thank you for all of that information. So I'm going to go ahead and check your room for safety. So I make sure that the bed is in lowest position. There's no clutter in your room. The side rails are up. Your call bell is within reach. Okay, room is free of clutter. Bed is in lowest position. Call bell is within reach, and bed is locked. Perfect. So today your doctor ordered for me to insert a urinary catheter for you due to your urinary retention. Did you have you had any procedures on your meatus or any difficulties with inserting a catheter in the past? Perfect. Thank you for that information. Since we don't have any issues there, we can go ahead and move forward with it. So it is a little bit of an invasive procedure, but I'll make sure to keep you as comfortable as possible throughout the procedure. I'm sorry that you didn't have a blanket on. Okay, so you have your blanket on now. Okay, so definitely keep you as comfortable as possible throughout the procedure, and so keep you as comfortable as possible throughout the procedure, and we're gonna go ahead get you take care of your perineal. We're gonna do some perineal care for you. Then I'm gonna go ahead and insert the catheter for you. Do you have any questions for me? Perfect. And if you have any issues or difficulties, please make sure to let me know. So we're gonna go ahead and start now. I'm gonna raise your head. Raise your head. I'm gonna raise the level of the bed higher to working height. And I'm going to go ahead and put the side rail down. I'm going to wash my hands and put on gloves so I can go ahead and provide you with perineal care. Okay, everything's good here. You still feel comfortable? Perfect. So to start off your perineal care, I'm gonna just go ahead and do the four corner technique. So we're going to do, first we're going to also put your recumbent position. So we're gonna lift your legs so that we have space here. And then we're going to go ahead, start here, furthest away, top to bottom, least contaminated to less contaminated. Second, top to bottom, least contaminated to the most, and one down the middle. Perfect. So we did all of that. I'm going to go ahead and take off my gloves and wash my hands. You still comfortable? Perfect. So I'm going to go ahead and wash my hands again. And I did identify the urinary meatus. Make sure your legs stay up and you're comfortable. Now wash my hands again just to make sure. So wash my hands again. And now we're going to go ahead and start on the procedure. I have your extra gloves if necessary, and I have the tape here to make sure that we get everything locked. Okay, so I'm gonna open it up here. I'm gonna use this as my trash bag. Putting it at the top of the bed. And then we're going to begin opening, and then we'll move it closer to you. Making sure to maintain sterility, do not contaminate anything. We're going to touch the outer 1-inch barrier and move closer up. Perfect there. I need to move back a little bit. Okay. I'm going to take the corner and put the shiny side down, let it fall naturally. Here's that. My hands aren't sterile. My hands aren't sterile, so I'm going to go ahead and put on my sterile gloves. And everything would be waist level or higher to maintain sterility. Okay, putting on my first set. Okay, so I have my sterile gloves on. I'm gonna go ahead and fix this here a little bit. Okay, still sterile on sterile. Okay, so, and then I'm going to go ahead and move this maybe a little bit closer. And thing is still sterile. I'm gonna put this shiny side down, making sure not to touch anything up there. Okay, so I have all of that done, maintain everything up, sure to not contaminate anything. So I'm gonna put the aseptic solution on here, air drop, and I'm also going to put the lubricant down here for the catheter, air drop, and I'm making sure that the catheter is closed. Perfect there. And I'm going to aseptically take out everything. Okay. Everything, airdrop this here. And then we're going to leave this inside the lubricant. And we're going to get the solution, airdrop here. Then we're going to go ahead and connect here. So once we're ready, now we're going to go ahead and clean the perineum while still, of course, maintaining sterility. So we're going to get first one, clean outer side, drop, closer side, least contaminated to most contaminated, drop, and one down the middle, least contaminated to most, and drop the forceps. And now we're going to go ahead and insert the catheter. Okay, and then once I go ahead, this can remain contaminated. Okay, Miss Anna, I'm going to go ahead and touch your perineum. And I'm going to, now my hands will be contaminated, and I'm going to go ahead and insert the catheter. Please bear down for me while I insert. Having the catheter 1 to 2 inches away, I'm gonna slowly go ahead and insert. Okay, 1 to 2 inches, and then another 1 inch. I see urine. Another 1 inch. Continue to bear down for me. It feels okay? Perfect. So I have it inside. Now I'm going to release the, and then hold it here. And I'm going to go ahead and put in the fluids. Perfect. So now we have that here. Drop it in. And then I'm going to pull to make sure that it's in. So everything is good there. And now I'm going to go ahead and put the catheter below the bladder and making sure that it's on a non-movable side of the bed and it has no kinks. And I'm going to also tape it down. So I taped it down, leaving a little slack on the patient's leg. I'm going to also put her legs down so she can become more comfortable. Okay, so everything's done. The catheter's in. You tolerate everything really well. So I'm going to go ahead and rid everything of the hospital supplies. And I'm going to make sure that she's comfortable. So I'll put her blanket back on. And goodness, how would you do this? Okay, so put her blanket back on, and I would document her outtake. So I would document, yeah, I would take my gloves off, clean the area of all medical supplies, and I would wash my hands, and I would document the outtake. I will document I have put in a 14 French, that it was clear color, there was no odor, it was regular consistency, and I got 200 mLs of urine out from her catheter, and I inserted 10 mLs of saline into the catheter, and she tolerated it really well. Okay, so I documented everything, and she tolerated it really well, and I would go ahead and do another safety assessment. I'd make sure that she has perineal care throughout the procedure, making sure that she remains clean. So I documented everything, make sure she had perineal care. I would go ahead and make sure that she's comfortable. I would assess the room for safety. Make sure the bed is in lowest position, that the room is free of clutter, and that the room is free of clutter. And I would put the bed back down, and I lift the side rails. Okay, so I cleaned the room of clutter, took all the medical supplies away. I'm not doing it because we may have to use this again in the future. So get rid of all the medical supplies, made sure she had perineal care at the end. I made sure I documented color, odor, consistency, and amount, and 14 French is what I used. And I made sure that she's comfortable, and the bed is in most position. Your call bell's within reach, and everything is safe. So call bell's within reach, the bed is in most position, it's locked, the room is free of clutter. And one other thing that I would do, hold on, I did everything, documented everything, and I wash my hands when I leave. Oh, of course, is there anything else that you'd like for me to do for you, Miss Pawlowski, before I leave? Perfect. If there's anything that you do need, if there's any discomfort for any reason, the call bell is right here, and I'll be in frequently to also check on you to make sure that you're doing well. Perfect. Thank you so much for your patience. You have a great day.